long-term follow-up of CAR CD19 therapy in acute lymphoblastic leukemia. My name is Luis Roberto Ziegler. Definition: the therapy. This research is influxed to the self-impacting with acute lymphoblastic leukemia ALL using a research called Chimera or CAR CD19 for the treatment of tumor application of medicine. The treatment increased the survival of the pain in an infant of 85 pounds and although is low of 40 pounds again ALL using the CAR CD19. Pros: they help produce new T cells, eliminate all tumors. The use in shielding is very effective. The research was prolonged until CAR CD22. Cons: very expensive method. Extend to repeat the treatment producing depth in adult train is not considered effective. The study followed if time can last 29 months. In Salt in Ecuador, in 2015, this new treatment technique against ALL cancer was introduced with good results 5 years of survival without cancer. Continue movie.
The immune system defends the body against disease. T cells are one of its key soldiers, targeting infected or abnormal cells. But cancer can block those defenses. Now scientists are genetically engineering patients' own T cells to make them smarter and tougher at seeking out and destroying cancer. One version is called CAR T cell therapy. T cells customized to zero in on a patient's specific kind of cancer. It all starts when a patient's blood is filtered through a machine that separates T cells and other white blood cells from the rest. Scientists mix the collected T cells with a virus that has been disabled so it won't cause illness. Instead, that virus carries genetic instructions for the T cells to grow an artificial receptor called a chimeric antigen receptor, or CAR, that will track its cancer target and rev up for an attack. Millions of copies of those engineered cells are grown in a laboratory and given back to the patient intravenously. The first CAR T cells are being tested against types of leukemia and lymphoma that bear a marker or antigen named CD19. Once in the bloodstream, those CAR T cells home in on that antigen and grab hold. They release toxic chemicals that trigger a cancer cell's death. As one cancer cell dies, CAR T cells move on to the next, multiplying in the patient's blood until they're no longer needed.
Continue to conclusion. Conclusion: the median overall survival was 12.9 months among patients with a low disease burden. The medical overall survival was 20.1 months and was accompanied by a markedly lower incidence of the cytokine release syndrome and neurotoxic event after 1928 CAR T cell infusion than was observed among patients with a higher disease burden. Finally, the CAR T cell.
using Powtoon.
Finally, thank you.